Mm.
There is a disease out there that has become a household name. It is a disease with no cure, and it is a disease that might have affected somebody that you love here in the past or present. This disease is breast cancer. My great-grandma suffered from breast cancer, but luckily she survived after having one breast surgically removed. Now, as a woman and as a healthcare professional, I believe it is important to understand breast cancer, past, present, and future, because according to some statistics found on breastcancer.org, last access December 18, 2016, 1 in 8 U.S. women will develop an invasive breast cancer over the course of their lifetime. But what exactly is breast cancer? How is it treated? And what is its future outlook? These are questions that I will be answering for you here today. In a brief history done by the Mara Foundation on breast cancer, last updated August 16, 2013, cancer has been around probably as long as humans have. Skeletal remains have found cancer cells in a 2,700-year-old Russian king and a 2,200-year-old Egyptian mummy. They were diagnosed with prostate cancers. According to breastcancer.org, they define breast cancer as an uncontrollable growth of cells. It is a malignant tumor developed from cells in the breast. As you can see here, there is a malignant tumor developed here in the breast. These are all of the cells, and this is a simple mammogram. These tumors are always caused by genetic abnormalities or mistakes in the genetic material. But statistically speaking, only 5 to 10% of breast cancers are due to abnormalities inherited from the mother or the father. But 85 to 90% of genetic abnormalities actually come from life in general, day-to-day wear and tear of life. So now that we know how long cancer has been around, let's see how it may be treated present day today. The treatment for the cancer widely depends on the type of cancer that it is, the stage, and the rate of growth. Many labs and scans are done in order to narrow the focus of the treatment that you might get. According to an article from the National Cancer Institute, last updated October 12, 2016, they defined the 5 types of standard treatment for this malignant tumor. The 5 types are surgery, radiation therapy, chemotherapy, hormone therapy, or targeted therapy, surgery being the most common. Surgery ranges from simply removing the tumor or removing the breast, which is referred to a mastectomy. But even if the entire tumor is removed, the patient may still receive radiation therapy, chemotherapy, or hormone therapy afterwards in order to prevent the tumor from coming back. But like all things in medicine, treatments are always evolving. So let's see what the future may hold for cancer. Research is in constant motion. New technology and approaches are done every day all over the world. There is newer technology in order to detect these tumors. As explained by the Cancer Society online website, last reviewed September 19, 2016, there is a test for detecting circulating tumor cells. These tests are in development, but research says that in women with breast cancer, cells may break off of the tumor and enter the bloodstream. As you can see here in this diagram, this is a tumor, this is a cell that will enter the bloodstream. These can be detected by the sensitive tests that are being developed. These circulating blood tumors will enter the bloodstream and can be detected later on. Now, these may predict which of the patient's tumors will come back even after they have been surgically removed. But for women with advanced breast cancer, it may be a test to simply tell us whether or not the treatment is working. Now that we have seen how complex cancer and its treatment may be, it is important for all men and women to be proactive in detecting breast cancer early. Beginning at age 40, women should get annual mammograms, but even sooner if there is a history of breast cancer in the family. It is important for women to keep a lookout for suspicious breast lumps and not ignore any symptoms that may be out of the ordinary for them, because early detection is always your best bet for winning or beating this terrible disease.